Most people think of breast surgery as either cosmetic or medical, but in reality, it's both. It's not just about enhancing what's there or restoring what's lost, it's about helping women feel holistic again. Welcome back to the Canvas of Beauty. I'm Dr. Fadi Bakal, board-certified consultant plastic surgeon, and today I'm walking you through the world of breast surgery, from the artistry of breast augmentation to the life-changing journey of reconstruction. If you're considering surgery, preparing a patient, or simply curious, this episode will bring clarity to the choices, techniques, and emotions that surround this deeply personal area of plastic surgery. Breast surgery isn't just about size, it's about proportion, balance, and confidence. We often divide breast surgery into two categories: aesthetic, which includes augmentation, reduction, and lifts. Reconstructive, on the other side, is typically after cancer, trauma, or congenital differences. But the truth is, they often overlap. Many women who undergo reconstruction want natural, beautiful results, and many cosmetic patients have real functional concerns like back pain, asymmetry, or changes after pregnancy and weight loss. So today, I'll be guiding you through both sides of the story and showing you how form and function always go hand in hand. Let's start with aesthetic surgery. Breast augmentation, the goal today is natural enhancement, not oversized implants. Patients are asking for shape, balance, and softness, not volume for volume's sake. We use a wide range of tools like silicone implants, fat grafting, or often a combination of both, a technique, a hybrid technique, which I really like to perform. And we personalize everything: implant shape, projection, and placement. Breast lifts and reductions, these surgeries are about restoring the breast to a more youthful, lifted position. Whether it's post-pregnancy, post-weight loss, or just aging, many patients want a refreshed shape without necessarily going bigger. Scarring matters too. I use techniques that minimize scars and preserve nipple sensation as well as blood supply. Quick insight: a lift doesn't add volume, it repositions what's already there. So often we combine it with an implant or fat to restore fullness. Or if already sufficient volume present, I use a special technique where I reuse the volume to redistribute the tissues as if I'm using an implant or fullness. Thus, a totally natural approach without the use of implant. Now let's talk about reconstructive surgery. After mastectomy, trauma, or congenital conditions, breast reconstruction is not just physical, it's emotional. It's about identity, femininity, and feeling complete again. Options for reconstruction include implant-based reconstruction, often with a tissue expander at first, followed by a permanent silicone implant that we already use also in aesthetic breast surgery. Autologous reconstruction, on the other hand, where we use the patient's own tissue like a Dieppe flap from the abdomen. The advantage of having a tummy tuck while performing a total breast reconstruction, a two-in-one procedure. Techniques like nipple-sparing mastectomies, oncoplastic surgery, and 3D tattooing for areolas also all help recreate not just a breast, but a natural-looking breast. A very important note is there aren't just surgeries, all these options. They are deeply personal decisions, and I always take the time to match the right method to each patient's body, lifestyle, and values. Whether aesthetic or reconstructive, good preparation makes all the difference. What I discuss with every patient is health history and smoking status, skin quality and tissue elasticity. Realistic expectations equals better results. Long-term planning, implants may not last forever. Also, we talk about scarring, recovery, future breastfeeding, and sensation. These are real concerns and they deserve real answers. Sometimes the best result comes from saying no to the wrong procedure and yes to what's right for your body. The future of breast surgery is exciting. Smarter implants with advanced textures and responsive gels, fat grafting becoming more precise and reliable, and not only on the breast. Bioengineered tissues to support reconstruction, better imaging tools for surgical planning and safety. We're no longer just reshaping breasts. we're reshaping the experience around them. Breast surgery is never just cosmetic or just reconstructive. It's the blend of personal, emotional, and artistic touch together with deeply meaningfulness for the patient. A holistic approach, if you will, for every individual, which will reflect three important conditions. 1. A boost of self confidence. 2. Improved self image. And 3. A better balance between the inner and outer. If this episode gave you insight, whether as a patient, provider, or someone curious about plastic surgery, please share it with someone who needs to hear it. And don't forget to follow the Canvas of Beauty, my podcast, for more episodes that go deeper into the reality behind the surgical results. I'm Dr. Fadi Bakkal. Thank you for listening, and I'll see you in the next one or in my clinic.